Is it possible to survive Lyme disease? This is part of a Common Sense Lyme series where I discuss cases I've seen and questions that I see in my practice. I'm Dr. Cameron, so let's begin. The short answer is yes, especially if you get diagnosed early, treated early, but the outcomes vary if you've been sick for a while, but certainly treatment is possible and quite often is effective. Why timing matters. In early stages, the full recovery is much easier. It's a good outcome, but that even gets complicated because there's co-infections. Maybe 1 out of 3 people might have chronic illness later on that it needs to be addressed. There's a disseminated stage where it's still like early Lyme. Treatment is easier to start if you recognize the multiple rashes. The real problem is late stage, where chronic symptoms may persist, but treatment still helps. Now, some symptoms may persist for at least 6 months, so there are doctors who like to use the word chronic Lyme disease. That's the preferred word I use, but others use the word post-treatment Lyme disease syndrome. That is, they've had at least a month of therapy and they're still sick 6 months later, but there's some doctors that refer to it as a syndrome. Typically, the classic symptoms are fatigue, brain fog, and joint pain. But there's also other issues like autonomic and neurologic symptoms. Even though some doctors assume it's a syndrome related to the immune system, they also discuss that it could be from a persistent infection or co-infection. So with advanced Lyme disease complications, what's important is Lyme arthritis, neurologic Lyme, but that includes cognitive problems, waves of mood issues, neuropathy, sometimes pins and needles in the feet, but also there's Lyme carditis. But recently there's more discussion of autonomic issues which raise the sensitivity to light, sound, heat, and cold, that raises the changes in blood pressure that sometimes is equivalent to POTS. There's troubles with the stomach, the bladder, and a variety of other issues that are hard to put your finger on, but they're more of like the automatic functions in the body. So yes, you can recover. Antibiotics and co-infections, including Babesia, have been recognized as important. Neurologic and physical rehab, I take more of a personalized approach for most of my patients. That is, I address their diet, get rid of alcohol, but more important, I counsel them in what it's like to be that sick for that long, how to set goals, how to set directions, how to organize other specialists if I need to. And that's why the lifestyle support, it certainly helps my case. The final thoughts is Lyme is treatable. Recovery may be quick. Even people who have been sick for months are surprised when they get better. The key is early action, comprehensive care, and persistence. I do have to tell you that there are people who are not getting better. Sometimes a change in treatment does it, but I certainly have some patients who fail treatment. So we get back to that original issue of, can I survive? Yes. Even people who are quite sick and having difficulties still are going through life, doing the best they can. They stubbornly try to stay social, stay active, go to family functions, despite the difficulties. I even have patients have found that difficult. So they're in bed, on the couch, very removed. And so no matter what happens is that it's worth treating from my perspective, being aware that even chronic Lyme disease is treatable. But unfortunately, until we get better information, there are always some people who are going to fail treatment. So thank you for joining me as part of this Common Sense Lyme series. Have a good day.